Good afternoon, everyone. Welcome to our Focus Forum. I'm Rita Riker, President of the Board of Focus Greater Syracuse, and I'm just very happy to have you here today. I'm delighted that we have representatives from Peace here today. They're going to tell us a little bit about the findings of their community needs assessment, and we're very anxious to hear some of the things that they found. So we're going to get right to it, and we're going to start with, I'm going to spotlight here, and we're going to start with Carolyn Brown, who's Executive Director of Peace. Carolyn, please introduce yourself and set the stage for us.
Thank you, Rita. First, I want to thank Focus for the work that they do. I really believe that communities grow stronger when people are coming together, learning about new issues, have different opinions, can discuss those different opinions. So I want to thank them for providing this opportunity, not just for us today, but all the work they do across the years. So thank you for that. I am Carolyn Brown. I am the Executive Director of Peace Incorporated. And my role in the discussion today is to talk a little bit about community action, explain what that is, and then explain a little bit about the agency, about Peace Incorporated. So community action came out of the war on poverty. It really is an approach to fighting poverty where you center people who are living in poverty in the solutions, in the planning and the governance of the agency and the formation of the programs. We do this in a variety of ways. I'm going to talk about three today. So one, we have a tripartite board. So our board, the community action requirements require all community action agencies to have this tripartite board. And it is a third business people or typical board members. It is a third elected public officials or people representing elected public officials, and a third people living in poverty or representing people living in poverty. And I'll tell you, it makes for a really robust culture on a board to have that mix of people engaged with one another. A second way that we do this is community action is locally focused. So although there are community action agencies all over the country in every single state, the planning is done on a local level. So we can take an approach to the needs in our particular community. And the third way we focus voice is we are required to do a community needs assessment. That is every 3 years. This year, as you can see, Todd, with the help of Maribel, really took our community needs assessment to a new level. And they're going to get into the details of that. But first, I want to explain to you a little bit about Peace Incorporated. So Peace Incorporated is the community action agency for Onondaga County. We also do a little work in Oswego. We serve a little under 10,000 people a year. We have about 365 employees when we're fully staffed. We're hiring in case anybody's interested. And we serve people who are living in poverty and work with them to help them reach their potential for self-sufficiency. So the idea is kind of, you might start with someone in crisis, you move them to stability and hope to move them to a place where they're thriving. We do this through 9 basic programs. I'm going to run through those. I could talk about those all day, but I'll give you the quick rundown. So that's Head Start, which is an early childhood program, works with the whole family, gets children and their families ready for success in kindergarten and beyond. We have Big Brothers, Big Sisters, which is a mentoring program. We have our free tax credit program where we work with people who are income eligible to get the highest level of return on their taxes. And then maybe a little financial literacy, hopefully mixed in there. We have a weatherization program that goes in and weatherizes homes, can offer energy efficient appliances, lighting, insulation, things like that. We have our family resource centers, which are located in the neighborhoods they serve. often the neighborhoods of highest need in the community. And they are a resource for families in those communities, providing things like clothing pantries, food pantries, summer programs, and they're individualized, so based on what that community needs. We also have a slate of senior programming. We have foster grandparents, which is a senior mentoring program. Senior citizens go into daycare centers and classrooms to help individual children, and it's powerful. We have our senior nutrition program. We provide the congregate meals for Onondaga County. So those are seniors who are coming to a site to get a nutritious meal. They have socialization with other seniors, combats the isolation that is such a problem for our seniors. We have our Eastwood Community Center for seniors, and then we also have a small senior referral program. So I think I got them all. Was that 9? Okay. So we're very proud of the work we do at Peace. We take a whole family approach. We work with ages from birth to seniors and really try to stabilize families so that they can move forward. A very important part of that work is our community needs assessment. We look at those needs, and that's how we know how to adjust programs, how to make sure that we're serving the people with the greatest needs. So with that, I'm going to turn it over to Todd and Maribel to talk more about the community needs assessment.
Thank you, Carolyn. So my name is Todd Goehle. I'm Vice President of Strategy and Operations here at Peace Inc. And Maribel, you can introduce.
Yeah, Maribel Arce, I am the Director of Grants and Planning.
And so we were the primary people responsible for the research and the writing of the needs assessment. To echo Carolyn's sentiments, thank you, Focus, for providing us this forum to continue talking about how we can meet this moment that Central New York is facing right now. And that was kind of the premise. As Carolyn shared, community action agencies are required to do a needs assessment every 3 years. We believe that this year was an especially important one, given the transformational and the potential transformational changes that Central New York can face. Micron, I-81, the promise of Blueprint 15, all provide the potential for social economic mobility and as well as racial justice for our community. And so part of what we were driven by is to really, we want to make sure as part of our mission is that we want to provide conversations and the tools needed to make sure that the people who most need these opportunities can benefit from it. And that was a lot of our approach and how we went about the needs assessment. Regarding the needs assessment, a couple of things that I'd like to first start. I kind of like to give you kind of the basic overview of our approach. I'd like to provide you some key statistics to kind of have you all think about. And then we'll also provide some findings. And then Maribel will also provide an overview of a exercise that we use that kind of will help you get a better sense of the resiliency, as well as some of the systems barriers that many in our community face. First that I want to emphasize, and again, when we go in these conversations, we want to stress that this is a public document. It is available on our website. It is intended to be for public use. It's not just intended for planning purposes, but it's also to spur community conversation. And that's where that community action piece really comes in, is that these documents provide key instruments for providing informed advocacy and change. So please visit our website. Please follow up with us after this presentation. We encourage you, if you have grants, right now it's an exciting period of time. Just yesterday, they announced that, for instance, the $500 million that will be connected with the community engagement work with Micron is now available. There are facts or approaches that in our document that you could use to bring resources into our community. Please do so. That is what the premise of this document is supposed to be. The second premise that I would like to share is that we really champion an inclusive approach. This inclusive approach takes on a number of levels. I think first, inclusive is that there are many people in our community that are doing outstanding public research and advocacy around issues. Our fellow agencies, such as, for instance, CMY Fair Housing, is the leader in talking about housing and issues of, for instance, exclusionary zoning and some of the barriers that many residents in our community face to achieving safe housing. In our report, it didn't make sense for us to reinvent the wheel about housing. They're the experts. So what we wanted to do was build up and raise the voices of the quality research that's already being conducted, including, for instance, these forums that take place with Focus. And what we saw that a lot of what we wanted to do is that there's a lot of good work on housing, and there's a lot of good work on violence and transportation barriers. But we really wanted to produce a meta-narrative that built upon this research and built upon the voices of those living in poverty to really get to the essence and get a sense of what does poverty look like and how do we think about poverty in our community. Therefore, in this document, we were intentional about thinking of it as accessible. You'll see, for instance, if you go to the website, there are, we have an extensive chapter, we have extensive chapters outlined. There's maps, figures. There are chapters broken down according to single issues. It was also important to talk about this. It was important for us to ground the voices of those in poverty and those who serve poverty, because so much of the data that we have, while good, isn't necessarily keeping up with the conditions and keeping up with the experiences of those living in poverty today. And so we really, again, this inclusive approach is one in how we structured the argument that we hope you will find compelling, but that who we also incorporated. So who did we incorporate? We did community conversations with seniors, with high school students, and with low-income families. We did targeted interviews with case managers from across the county. So we were purposeful and not just being Syracuse, but thinking about what are the issues faced by residents in Tully? What are the issues faced by residents at Baldwinsville? We were also intentional about not targeting administrative level individuals, but really getting to the people who do the work on the ground. And so what we were able to pull off is almost more than 200 interviews, surveys, and conversations with individuals. And so we feel confident that we were able to get a really good cross-section of the community. The other piece was that when we did community conversations and we had these interviews, we tried to ask more open-ended questions, and that's part of what we want to talk about an inclusive approach. We asked them what they liked about their communities, what they disliked about their communities, who they trusted. And when we did that, we had a much more robust conversation, and we practiced what I would describe as deep listening, which we'll talk about soon, but really letting the individuals that we talk to drive our findings and drive our conclusions. So not going in and saying, what are your issues with housing, or what are your issues with transportation, but going in and letting them drive the conversations. And from it, we were able to receive some really unique responses. To that, then, again, there are statistics that should be shared out, and I'll share a few of them that I think should be on your radar. One is that, and most of you know this, again, some of these data points won't be shocking, but Syracuse, according to census documents, census surveys, the second worst city in terms of childhood poverty under 18 at 45.8%. What's even more staggering about that is that change from the previous year was only about a little more than 1%. And when you compare that to other cities, that drop was pretty minimal compared to a lot of the other cities in that top 10 range. So that what that tells us is that maybe we need to adjust our approaches. And that a lot of the reliefs that came through COVID, for instance, expanded tax credits, expanded SNAP, expanded unemployment, they went away, and we needed more of those, especially in our city. Another thing that we wanted to talk about and that we showed is that the racial income gap in our community is widening. There were statistics, for instance, we looked at median household income. And right now, the median household income for a white family in Onondaga County is $77,804. That's the average household income. For a Black resident in our community, it's $36,640. So that's a difference of 112%. And that's an increase from 2018 when the gap was 97%. So the gap in terms of household income according to race is widening, and we provide histories as well as context for why that is. Another, and many of you have heard this, is that Syracuse, Syracuse metropolitan area, so that's the 5-county region, has experienced a 22% average monthly rental increase in the last year, which is highest in the country. And right now, a 1-bedroom apartment is $1,050 in our community. Another issue that we wanted to raise in terms of statistics is that 28.8%, we noticed a 28.8% increase of the population from 2011 to 2021, that population being 65 and above. So what we see is if you look at, and again, you can look at that report, we have our demographics, our age differences according to race, location. We are experiencing, the county has a very much an aging population. In the city of Syracuse, it's even more severe. So nearly 50%, 42.8% of the population has increased, of over 65 has increased over that year. And a staggering increase of 110% in senior poverty has increased. So again, thinking about, as Carolyn said, whole family approaches, thinking about not just how are we supporting seniors or parents or children, but how are we supporting whole family units, it's going to be really critical. The other piece of this, and again, why this is a moment for us, is that as we hear from the news and Micron and other planners, this is a moment where we really need jobs. And what needs to be kept in mind is that according to estimates here by economic planners, a quarter of the labor force is 55 and above. And so you're going to see massive retirements that have already started from COVID. Those massive retirements are going to continue in the next 5 to 10 years. And so really thinking about, one, how can those retirees serve as mentors, as champions, and teach potential new employees. But two, how are we really ensuring in this moment of opportunity that those who need the opportunities the most can take advantage of them? We wanted to provide those statistics because those statistics were some of the most pressing or most staggering for us, and they very much complemented the concerns that we heard from our residents. And so there are a few key takeaways that we would like to share that when we interviewed people and we looked at these statistics that we think moving forward, we really need to focus and really need to ground our conversations for how to meet the challenges of our community. The first, and I'm guilty, I'm a former historian, so I'm going to always go back to history, but so many of our issues, so many of our problems still resolve from those lending practices in the 1930s known as redlining, urban renewal, and then exclusionary zoning, which really prevents housing and rental mobility for low-income residents, especially low-income residents of color into the suburbs. And what you do is then for a lot of the work, then everything that we do has to go through the lens of equity and thinking about structures. So the problems we face are not just these dilemmas of, for instance, childhood poverty have been longstanding, and they stem from these structural discriminatory practices. And we go into great length about what are those histories of assessment. Tied with that then is this idea that COVID really it really exasperated and intensified longstanding issues. One of the things that perhaps most of you have all felt is you go to the grocery store and what are you finding? Your grocery bills are going up, right? We have seen in the last few years a real staggering of inflation. One of the issues is that really hampers, and especially right now has hampered people in poverty the most. A lot of the statistics, and this is again why we wanted to interview people, a lot of the statistics that we first saw that there wasn't, for instance, food insecurity issues in 2021. We know that they are now if you talk to people. Statistically, it wasn't because you had expanded SNAP. You were putting more money into people's pockets through child tax credits. Most of those reliefs were taken away or ended in 2021 or 2022. But even then, you saw that inflation, prices were increasing in, for instance, groceries. And so while there was more money going into people's pockets, at the same time, costs were increasing. And so you took away those benefits in a moment when prices were increasing. What's also important is that while inflation impacts us all, inflation very much impacts people in poverty the most. Because the majority of someone who's living in poverty, their expenditures are on rent and food. And those are the two areas, housing and rent and food, one that we see has risen the most, but historically are most impacted in moments of inflation. So that's an example of how these were housing issues, food security issues prior to COVID that we're seeing increased. The third issue, and tied with this, is that really, we need to think of our solutions not in poverty is holistic. That's a great quote when we talk to a direct service staff member. They said poverty is more like a blanket. There are so many things that fall under poverty. To really address poverty, you need to address the trauma that has been inflicted, right? So many of our solutions, we're talking about jobs, we're talking about transportation, but they're all interconnected. And throughout the needs assessment, when we started talking to staff members and when we started talking to clients, we heard how these issues were very much interconnected. One example was, for instance, a woman who is a who is a victim of domestic violence. She was faced with the issue of having to give up her rent, her house, or keep her car because she didn't have the money to do both. And she ended up keeping her car as a point of security. That issue there, we see at least 4 basic issues right there. Domestic violence, mental health, lack of stable housing, lack of transportation. And we see how that interacts with one another. We have examples, for instance, of seniors who are choosing substandard housing because of proximity to a food source or a transportation source. A lot of the employment opportunities, we spoke with a woman who has a job, for instance, at Dunkin' Donuts. She would like to work full time, but she can't because it has to be around the basis of taking her kids to school, and she lacks transportation.
And perhaps interject, one of the problems we have is when we put people in silos, we're missing out on what are the consequences of the decisions they're making on one factor in their lives that impact them in everything else. So if you have an older adult that's moving out of their residence where they've lived for 20, 30 years and have a neighbor that cleans the snow for them, takes out the trash for them, let's make sure they're safe, and they're moving to a new place where they don't have this type of support, you're losing the support, his ability or that person's ability to get support from the community for what they need. And they're much more vulnerable to and need more support from institutions to get what they need. When you're talking about a youth or young families, you're not looking at probably they live with an older adult that as that person's aging will need more support as well. And so if we're talking about a population that's going to be aging very soon, we're also talking about a population that's going to be serving small children and older adults at the same time. And what is the impact that that's going to have on their ability to work?
Yep. And we see that, we provide statistics. We're fortunate enough to have data from our Head Start program, for instance. And we can make these connections. So for our data, for instance, we know that 2/3 of our clients, around 450 our clients, Head Start families living in the city of Syracuse live in formerly red or yellow lined areas. So this is west side and south side. We've been intentional to serve those areas. But again, when we talk about generational poverty, right? These are locations where the housing is substandard. In some of them census tracts, you have lead poisoning up to 1/4 of the kids in those census tracts. And you can see statistically, we show, for instance, of these populations, for instance, our Head Start parents, 51% of the households have at least one parent who's unemployed. 23% have no vehicle. Nearly 2/3 either have a diagnosed or undiagnosed mental health issue.
And if they're refugees or new Americans, they probably are undiagnosed and they do not declare it.
The
So
statistics
it's
that we
probably
have bear
higher.
that out, right? So, 35% have domestic violence histories. So again, you see where in the needs assessment, we do a good job, I believe, in talking about the histories and how these needs are interconnected.
And I think we also do a good job in having the client's voice coming in.
And the voice comes through, yes. So again, you'll hear the experiences of our clients and of the people who serve them. There are two other things that we want to talk about briefly. The second, the fourth is that, and again, we go into great depth about this. For us to meet these needs, right now, the social service system and networks are beyond taxed. And for us to meet these challenges, there needs to be real investments within our systems. These are not just arguments that are being made by us. The Health Foundation of Central and Western New York just did a research about rural outreach, and one of their findings was that under-resourced and underpaid nonprofits. A lot of this is the need for multi-year funding. So if you fund a nonprofit for 1 year, think about this. You're getting an investment for a year. If you're starting a new program, it's probably going to take you 3 to 4 months to hire someone to design the program and to get it up running. And already you're against the clock in order to make sure that that program could potentially receive funding another year. That has drastic impacts on the instability of who we can hire. That also drastically impacts and negatively impacts our clients, because where is that stability for our clients coming for a service that might not be there for 2 months, in 2 months? And the reality of, and we show this repeatedly, that this is stressful work. It's stressful work for the people who do it. It's stressful work for the people who live in poverty. And that's where the resilience comes in. These are not issues that can be fixed promptly. You have to build levels of trust. And the families that are pursuing this are resilient. And that's a lot of what we talk about, is that really we need to really think about how are we listening to our citizens? How are we incorporating citizens and people into poverty into decision-making? And how are we building power bases and power movements to really raise the issues that not just nonprofits who have trusted relationships with residents, but the residents themselves, that they're getting the needs that they deserve and really need for empowerment.
And perhaps highlight that sometimes the people we serve are just as eligible as our staff to some of these programs. So in human services, the funding has been cut so short for so many years. There's programs that have not increased in funding, do not have a cost of living adjustment, haven't had it in 20 years. And they're programs that we in the community significantly need, like childcare. And so, and we forget sometimes that these programs, the human services field, these are jobs that can't be easily done by somebody just out of high school. These are jobs that require emotional maturity. They require experience, lived experience. And there are also jobs that are very difficult for our agencies to find people that are qualified to do, because the requirements sometimes are very high, but the pay is very low for what is required. So when we're talking about what exists, it's different to say that there are childcare centers versus what are the effective childcare slots that are available, because there is not enough teachers for the classrooms. So when we're assessing our community resources, sometimes we forget what is the effective resources that families really perceive when they're navigating these systems.
And this is where, for instance, the design work that Maribel pursued is really helpful, because she's going to share her persona. And this shows you the intersection of how these institutions and systems play out in the everyday lives of the people we serve.
If you want me to do that? Okay, so a persona is basically based on a tool called human-centered design, and we created it. It's developed by the tech industry. They use it to kind of create a composite fictional character that unites it, puts together the observation of many people into one person. So you can't really recognize who it is, but it really represents the people you're trying to target, the population you're trying to target with services. So I'd like you to meet Amanda. She's a mother of 3 in her early 30s and living in a low-income neighborhood in Syracuse. Each morning, she wakes up at dawn to make breakfast for her high school son, James, who has to take the bus by 6 a.m. Often in challenging weather conditions, Amanda walks her other 2 children to daycare and to school, and then walks to work, where she is working at a part-time fast food restaurant. She works part-time at a fast food restaurant. As she's walking to work, Amanda dreams of saving to buy a car. If she had a car, she would be able to work more hours. She would get a better paying job. She could go to college. But then she remembers the income cap and worries if she will fall off the cliff and end up worse. If I hit that income cap, I will lose my insurance and my childcare. I don't know how I will pay those without public assistance. Amanda's situation reflects that of many people facing intergenerational poverty, where everybody is struggling to make ends meet, and therefore resources are scarce in the network of people you depend on. So, and Amanda really depends on herself to make her family thrive. Amanda moved to the city when she escaped domestic violence during the pandemic. Initially, she had been reluctant to call the police as her boyfriend's addiction got worse. When asked why she didn't leave him before, she said, "People don't understand that things have to be drastic to get real help. When the police arrive, issue an order of protection and leave, it has an impact too. It makes you more vulnerable." Amanda was beaten down and feeling very guilty of her life decisions by the time her boyfriend threatened her with a gun. It took Amanda a lot of effort to get where she is at right now. She's thankful to have a job that takes her mind off her worries, but she wishes it would come with benefits and be more hours. If for any reason she misses work, she does not get paid. So she constantly has to make impossible decisions. Should she tend to her son who's sick? Should she forego the food pantry to go to work? If she doesn't go to work, then she won't get paid. So which is the choice she should take? Amanda feels like she constantly has to advocate for herself and her family. Support exists, but you have to ask specifically for the program you're applying to and know that you're eligible for it way before you apply. And months may go by before you get help. You have to apply a month before food pantry to get services. Waitlists for rental support are long. Ensuring stability for her family while dealing with her trauma and the financial strain feel like an overwhelming burden for Amanda. By the time she gets home after picking up her daughters, James has been out of school for a long while and cooked dinner with food he got from the church pantry. James would like to play basketball, but there is no buses to bring him home after games, and Amanda doesn't want him walking at night alone. She's afraid of gun violence in her neighborhood, but she's also afraid of a neighbor calling the police on him for just walking outside in the street. Amanda worries that James might be recruited into a gang. She does not like him to go to the corner store where they sell synthetic marijuana, but there is little for him to do in the neighborhood that is safe. After helping with homework and putting her kids to sleep, Amanda's exhausted. Her heart beats fast as she opens the mail. Her landlord has increased her rent to $1,000, which is much more than she can afford on her $20,000 a year income. She might have to move again if she gets an eviction notice, but she knows that it will be difficult to find somewhere cheaper. Having to uproot her children, especially James, who struggled so much with the first change of schools, weighs heavily on Amanda. Amanda wipes her tears and opens her book to start studying for her high school diploma. At first, it's a first step to starting a new career, and she will study until she falls asleep. She can't stop taking these steps to create a better life for her family. Her resilience and determination, despite the trauma and hardship she faces, are truly remarkable.
The reality of that exercise, again, is that those are all experiences and statistics and data, and real life experiences that were shared with us during our work.
And when we have shared it with people from the field, we have been asked to use this for training to people for planning to go into human services. So this is a reality that a lot of our families face. It's not just them.
Thank you.
Thank you. Thank you. I'd like to move us to some questions. We've received a few questions ahead of time, and we're also going to open it up to the audience. I'm going to hand this over to Brian Hoke, an emeritus board member of Focus, and we'll take some questions.
Thanks, Rita. And thanks, Carolyn, Maribel, Todd, for being here today, and also for all the work you did. It's an interesting discussion. I find it optimistic and pessimistic. I find it engaging and frustrating. I'm sure you did too, but important things to get out in the world. We had questions submitted in advance. We'll go through a few of those, but as we are today in a forum and a format that allows for you, our participants, to speak directly, I'll ask anybody who has a question and is willing to ask it on mic and on camera to do so. I'll start with a summary of some questions we had in advance, but if you're interested, raise your hand virtually. I think we have the hand raise feature enabled. Put something in chat, we'll find you. But first, from a number of the questions we got in advance were about what's next, right? And you know, I think part of the purpose, I dare say, of this exercise, of this study, of all this work you put in, is to say, here's where things are, right? Where can things be? How do you, I mean, the study itself, right, is an exercise in prodding fellow agencies, government, concerned citizens to action. Where do you see it going? I mean, what's the next step in your hope for this work?
I think I can start. So first, I think it's really engaging with forums like this, because part of what I think we wanted to do with this report is to ensure and make sure that people were kept in the loop and people continue to talk about what this was, and to provide them with tools. So, for instance, when we have rolled out our needs assessment, we're not just talking to forums such as, Focus. We're also talking to the people that we actually had the conversations with. One of our concerns is that when we engage populations, and again, this is something, is important to Focus, is not just hearing them, but how are we responding back to them? How are we sharing with them what we're learning from this journey? And really talking about the needs assessment as a process, right? This is a process for spurring conversations. So for example, I can tell you when we went back to, for instance, seniors or the Head Start parents, we found Head Start parents, for instance, one woman, actually, she read the entire report and she went to her Facebook page and posted and quoted page 98 because she saw her comment that she said in our conversation.
Verbatim.
And what that tells you is that what we heard was that our residents don't feel heard. And when they do feel heard, they are deeply proud and they are motivated. Another example is with a senior who we spoke about, who was arguably one of the most outspoken seniors that we heard the first time. She did not say a single thing when we reported back our findings. She pulled Maribel aside to us and she told us, thank you for actually listening. That's why I didn't say anything, because you said what we had told you. So what's really important is that when we engage populations, we have to have the effort to go back and listen to them. We also need to really encourage our elected officials and everyone to practice in rhetoric, what they call deep listening. And what I mean by deep listening is this idea It's really pushing an inclusive approach. It's about if you're going into a community and talking about need, understanding your perspective, understanding your privilege and your power, listening actively to what you're engaging with the residents. Are you framing the questions and engagements in a way that's restricting confidence, that's restricting a variety of options, a variety of choices? So I think what, you know, at least what I would say is what comes next. We continue to have these conversations. We continue to see the confidence and the empowerment that come from people who participate. And we know that, for instance, we've been able to speak to politicians. We have been able to hear that, for instance, our reports have influenced budget decisions and how individuals are thinking. So
That's great.
yeah, it really is a process, and emphasizing the research as process. There are groups and there are entities, for instance, we do talk about new Americans or individuals with disabilities. It's a macro level approach, though. We can't necessarily get into every issue. So we understand that this has to be an ongoing process and an ongoing conversation. And we're looking forward, and we're hoping some of you reach out to us after if you want to help us and work with us to do more research.
Yeah, I would add to it is a moment in time where our local public officials are aware of the seriousness of the poverty issue on the future of Syracuse. And we need to try new things. And so as partners come together and pilot new programs, we need to work together. And we have that. I do believe that the service providers in our community want to work together. And so hopefully this spurs us forward in that direction.
That's great. Do you find even for your own programs, there are course corrections that even on a minor level, right? At a meal center, boy, it'd be great if the napkins were at the end of the line instead of I mean, even down to that level. Do you find some of that comes out of this process?
Absolutely. We, for instance, when we're looking at new sites, right? We're gonna look at the neighborhoods and what's changed and where the pockets of need are. Head Start is our largest program, and they are required to analyze their programming and the families they work with based on the community needs assessment. And we will continue to have those conversations within our own programs.
Interesting. Well, thank you for sharing that.
Yeah, I would say too, you know, internally, one thing is, I think these are trends that have been going, but the data and the interviews really bear out, for instance, the need to really practice whole family approaches. So what we mean by whole family approaches is funding can be tricky sometimes, right? So our programs need to, we're not just talking about community collaboration, our programs in our agency need to collaborate, right? So a lot of the findings has, you know, what are the ways in which we need to think about grading our resources more effectively?
Mhm.
You know, we have a lot of evidence from our fatherhood initiative that we want to scale up, that we see that, you know, confidence in fathers, first-time fathers, helps them, building confidence in self might be the first vehicle to get a job. It might not be a job that's needed to build that confidence. And all of a sudden, if you're starting to talk about your confidence in your role as a father, guess what? You're also setting goals for your kids. If it's a Head Start family, the Head Start kids are going goals. So you're seeing how that development and that social economic empowerment is interconnected across generations. And those are things that we really want to emphasize. I think we also we understand that diversity, inclusion, and senses of belonging are, you know, necessary instruments throughout the community. A lot of the members of the community who don't feel heard are also our employees, right? Mm-hmm. And so part of that is, if we're going to talk about a community that comes together and practices senses of belonging and good listening, inclusiveness, we better walk the walk. We better walk the talk as well. So I think those are real tangible, concrete improvements that I think we can say we're pursuing internally.
Got it. Cool. Thank you. Well, thank you everybody who's here as well. Does anybody in the audience, as it is, have a question they'd like to pose themselves? Can't all go at once. Well, I have a quick one while folks are perhaps thinking of their question. I'm interested in the actual process of the assessment. Were there ever, I don't know if tensions is the right word, but a dialectic between the quantitative, right? Here's what the numbers show us from the census data or what have you. And here's what we hear from repeated interviews. There must be places where those things, if not came into conflict, but perhaps led to different assessments, different analyses of a given situation. I'm curious if you could highlight any of those, if any of those did indeed come about.
So I think the first most obvious was at the time when we wrote it, Feeding America, which is the foremost, again, we use the host of data, so census data, Feeding America, which is a national entity that tracks food security. Their most updated data was 2021 when we wrote the initial report. And it basically was one of the
actually, we had made a dent in poverty by 2022.
Yes.
And then 2023, all the benefits were cut off. So
Yeah.
we're gonna see the dent disappear this year.
Yeah. So they actually did release the 2022 data and the food insecurity increased. So when we wrote this, we knew that talking with the community, at that time in 2021, it was the most secure, I don't know what you would say, food secure, right? And there were improvements that were seen across typically vulnerable populations, especially minorities and single women. And our interviews told just the exact opposite of it. A lot of the data too, I would say, and maybe this is more subjectively, but I think a lot of the data takes away the agency. It doesn't represent the agency and the resilience of the clients. And so, for instance, we had information from our free tax prep program. We file I think last year we submitted up to 1,800 tax filings, right?
Wow.
The average person who comes to our free tax prep site has an income of $25,000, household income of $25,000, and is 51. So what's interesting is you think that that's a impoverished community, and we realistically still live in a society that believes, that people in poverty don't work hard, or that people in poverty are trying to cheat the system. So when we do exit surveys, for instance, we find, for instance, in a pool of 900 people surveyed, 40% of them try and want to save their money to buy a house or to build a car or to save for a rainy day. We see intentionality behind the numbers that doesn't come bearing out in the numbers. And more, I think my experience, at least, Brian, to your point, is that the real tension that the numbers don't tell you the lived experience of the individual, and more, and that's what that inclusive approach drives home. You got to talk to people and you got to figure out what they're saying to you, because there's complexity that is oftentimes lost in those numbers. And part of that inclusive, equitable approach is foregrounding the voices that bring the lived experience to a nondescript number.
That's great. That's interesting. Thank you for sharing that. Other questions from the folks?
Brian, John Seltzer had a question.
John, go ahead. I hadn't noticed. I apologize, sir. Go ahead, please.
Thank you very much. I'm the executive director of a new organization called Planting Seeds, where we're trying to build bridges in this divisive world we're finding ourselves in at a variety of levels. I was a previous social worker, ran a business for 30 some odd years. One of the things I'm having a hard time reconciling with myself and people I'm talking to is how we have become the second largest city for childhood poverty in the country. The sense of urgency is beyond now. We are in a crisis mode, and I appreciate all the work Peace Incorporated has done, Focus Syracuse is doing. We have a major crisis with regard to the politics of the time of how we raise these issues. We need to teach the political structure, how a sustainable approach to poverty is necessary, not a one and done Band-Aid, meatball surgery, quick funding because it seems to be the chic topic of the year approach. Bureaucracies punitively taking money back from people who get out of poverty, even if it's negligibly out of poverty because they have a lawsuit or whatever, or buy a car and have new assets to declare, and the lack of funding on a sustainable basis. Is this action plan, and I've read most of it, I can't say I've read the entire plan. Is this action plan designed to take action immediately, to build the coalition between all of the enormously good organizations in town working in small pieces of this puzzle? How do we bring it all together? How do we teach the politicians and the funding agencies? It's wonderful thinking about Micron coming in with $100 billion, a third of which is taxpayer credit. So, you know, that it's coming out of our pockets. How do we change the culture of doing this? There was a couple of years ago, there were two women that came out of Contact Community Services trying to establish Bridges Out of Poverty, a nationally known program with great viability and success rates and sustainability at a very low cost. And they couldn't find funding to get that initiative going. It's still, you know, an idea that could very well be viable. How do we break down the barriers that giving people money to get them out of poverty without strings attached may have a great impact in this community? An incredible amount of empirical evidence that says if you bring someone out of poverty by giving them money so they have a sustainable lifestyle, the money's going to go toward food and housing and healthcare. And it's the level of fraud, and we see it in food pantries. The analysis is pretty low, somewhere between 3 and 6.5% of fraud rate, which means over 95% of people who are going to those pantries need the food. No one goes voluntarily. How do we begin to change the culture? I don't have time. I'm an old guy, so I don't have time to go backwards and worry about some of the causation. What do we do from this point forward? Because a child in poverty, food insecure, housing insecure, healthcare insecure, today, we're going to be willing to write that child off because they're going to have higher levels of mental health issues, lower academic achievement, likely a higher incidence of domestic violence if we do nothing for that child, or if we do nothing.
Let me jump in there and let the panelists give it, just because we're coming up on time. But
Yeah,
thank you for the question.
Thank you.
Well, John, first of all, I want to say you sound like somebody who we should have lots more conversations with, because you're talking our language. So, and I think what you're talking about is changing the system, right? Like, as opposed to starting a program. And that takes a lot of people coming together. And I think when you talk about the politicians, like, that really is the level of change that we're going to need. So when you call this document an action plan, this is like the research for the action plan, but the action plan does need to come.
Yes, yeah. And I think there are there are definitely recommendations. I think one of the things is, again, understanding this. The childhood poverty isn't just necessarily children, but it's whole family, right? And so I think moving some of these conversations to whole family conversations rather than child poverty conversations is a really useful change and a useful reframing of this. And I think, for instance, at least there are some interesting structural things that are going here in the county that has the potential to be scaled up that you touch on. For instance, one thing that we've seen is, for instance, Onondaga 2Gen, which has been a specific program developed by social services, DSS, to target single mothers under 25. And what does it look like to provide them with holistic supports across the broad spectrum of what you're talking about: mental health, job placement, etc. Also, what does it look like to be more flexible in eliminating or relieving those eligibility cliffs? So what does it look like instead of when you hit 200%, you lose your benefits? There's encouragement then to,
So you make a slide.
you make a
Yeah.
slide, right?
Yes.
And so far, the findings, this is a small pocket, but that's a promising practice that ties into some of the issues that you talked about, that incorporates some of the practice that's abroad, outside of the region, that has good potential, in sort of reframing this.
And perhaps I come from a previous background in international development, and can I just say a small criticism?
Yeah.
There's a lot of stuff that has been tested out of this, not in the US, internationally, of what works and what doesn't. And where are the, like, policy-wise, what works, what we should be doing, and even tweaks that we can do to our programs and our systems that are creating friction for people to access. We are very focused on creating friction for people to access services instead of making it easier for them. And all these things, just look up, the World Bank has a lot of resources in that. Even USAID, which is funded by the United States government, has a lot of resources on what is being done internationally. We don't look at what's being done globally. There's a lot of knowledge to be learned there.
Well, I'm sorry to step in and interrupt. I'm sure I'm not alone in saying I would be happy to talk about this or hear about this more for another hour, but sadly we're out of time. Rita, I'll turn it back to you.
Thank you, Brian, and of course, thank you, Carolyn, Todd, and Maribel. Wow, a lot of great information. It's a little overwhelming right now. There was a question in the chat. Is this going to be available? Yes, this will be. We've recorded this session. It will be available on our website in the next couple of days. Give us a little time to do some editing but yes, it'll be available. I also know, Carolyn and Todd and Maribel, there are a couple of people here who are really anxious to talk to you about how your organizations can collaborate. So you may be getting some phone calls as a result of this.
Sounds
No.
good.
Yeah,
Will you be sharing our contact information, Rita? I think somebody was mentioning that, or maybe just tell people, just write to the info, our info.
Yeah,
page,
info at
and we'll
peace.
respond.
Yeah.
okay, great. Info at Peace Inc. or
Yep.
Yeah.
Okay.
Yeah, if you go to our website, it has contact us and you can fill in the page and.
Super,
We'll get back.
super. Again, thank you so much. And thank you all for being here. Wonderful attendance here today. As I mentioned, our website, focussyracuse.org, we'll have the link here. We also have a very easy way to make a donation if you'd like to make a minor donation or a major donation to Focus. We would be very pleased to receive that. So have a wonderful weekend. And again, thanks to all. Take care.
Thank you.